night before your surgery, you're called by the hospital to tell you what time to come in. Sometimes that's very early because our operating room starts at 7:30 and we want people there a few hours ahead of time to get ready.
You come in, you get dressed in your fancy gown, and you get your IV, and then myself or Dr. Borst come in and we meet you. You do not go to sleep before you see your surgeon the day of the procedure. And you'll meet the anesthesia team and the nurse team. You'll be asked your name, your date, what procedure you're having 100 times, it'll seem like. That's all for patient safety.
The surgeries themselves take from an hour to 2 hours depending on the operation. After that, patients go to the recovery room where their families can visit them when they're awake, about 45 minutes after they leave the operating room.
The most important thing for patients to know about getting rid of that bloating feeling is to move around, to walk the hallways, to change position by sitting in the chair, getting out of bed. Even just sitting at the side of the bed and dangling the legs helps.
4K South has been specially suited for bariatric patients. Our new rooms are all individual rooms, no roommates, individual bathrooms.
All of the rooms have a pull-out sofa. Each room has an oversized chair, plus we have bariatric recliners. They are allowed visitors from the time they come in till the time they leave.
Dr. Harrison and I like to see our patients post-operatively, if possible, in the recovery room or up on the floors, and on the day after surgery before they go home.
The first night when the patient arrives to the unit, the patients are not allowed to have anything to eat or drink.
The morning after surgery, patients go down to X-ray, where they get an upper GI X-ray, which means they'll drink some liquid that shows up on an X-ray, and we make sure that everything looks good with the surgery and that there's no leak or no obstruction.
If everything's a go, they come back to the unit and we will advance their diet. And they'll start with a clear diet. Clear liquids include broths like chicken broth, light colored things, nothing with red in it. So it would be things like apple juice, water. No carbonated beverages. They cannot have any caffeine, no sodas, anything that have that bubble in them. Patients will not become dehydrated while they're on the unit because we have them hooked up with a saline IV, and they will stay on that saline IV until we advance their diet. We do offer lip balm, or you can bring your own chapstick because sometimes your mouth is dry.
Most patients usually go home later in the afternoon on the day after surgery.
Most patients, we say, should take about 2 weeks off of work. Occasionally we've had band and sleeve patients that can go back a little bit earlier depending on the type of work. Sometimes gastric bypass patients need a little bit longer.